welcome back to All Things Plastics, where beauty meets real talk. Today's guest is someone I've been so excited to bring on the pod. She's not only a highly experienced nurse practitioner, but also a total powerhouse in the world of aesthetics. Originally from New Jersey and now based in LA, Jess has spent over 10 years in nursing, including years in the high-intensity world of ICU care. But like so many of us post-COVID, she pivoted. And for the last 3 years, she's been thriving in aesthetics, bringing a unique and educated approach to anti-aging, skincare, and non-surgical treatments. Jess specializes in facial plastic surgery and is all about treating the root cause of aging, not just putting a band-aid on it. From lasers and fillers to neurotoxins and skin treatments tailored for skin of color, Jess really does it all. She also works closely with patients on weight loss medications, helping them safely navigate their journey and maintain results long term. Whether you're curious about which neurotoxin really lasts the longest or how to treat volume loss without going overboard, Jess is breaking it all down for us today. So get ready to take some notes because this episode is packed with gems. Let's welcome Nurse Jess to the podcast.
Wow, that was a great introduction. Thank you.
Well, you definitely deserve it. You are taking social media by storm and educating all the girls out there and doing fantastic work. So I'm so excited for everyone listening to really get educated on the aesthetics world because it is an in-depth world to dive into and understand.
It is definitely. Super excited to get into everything. We have a lot on the list today.
Let's start off with your background. Where did you grow up and what was life for you growing up there?
I grew up in New Jersey, so kind of in the suburbs. I had a great childhood growing up, so I wouldn't change a thing, but at some point you just kind of outgrow your hometown. And so I made my way out to LA about 5 years ago, and I have absolutely loved it. My life has changed in so many positive ways that I couldn't imagine, and can't wait for the future too.
Growing up in New Jersey as a little girl, did you kind of always have on your mind like, okay, I want to be a nurse. I want to be a nurse practitioner. Or did that come later on in life for you?
It did start early on for me because my mom's a nurse. So I just kind of would follow her around a lot and bring your kid to work day. So it always interested me, and my little sister's a nurse too. So it runs in the family. I wasn't sure at the time what I would specialize in, but I just kind of fell into that.
And that's the same with me. My aunt, she's a labor and delivery nurse, and she used to take me to the hospital with her, and I would sit in the nurse's station. I was like 10 or 12. And back in the day, you're not supposed to do this, but back in the day, her nurse manager loved her, and I would answer the call lights and go take water to the moms and stuff. So, and I was like, you know what? I knew I didn't want to do labor and delivery, but I was like, I want to be a nurse. And we used to watch ER back in the day.
Yes,
so,
same.
Yeah. And before you became a nurse practitioner, did you start underhand as an LVN or RN? And then while you were going to school, or did you go straight through to NP?
Yeah, I was working at the same time as going to school. So I started, as most people start out, working as a nursing assistant while I was in nursing
Me
school.
too. I was a CNA.
Yes. And then I was working as a nurse back in Jersey after I graduated, and the college that I went to, Fairleigh Dickinson, they had a program that they would give some kind of grants to people working at Hackensack Hospital where I was. So I worked at the same time as going for my NP, which that took a couple years, but you gain experience at the same time. So it was a great way to go. And at the time, it wasn't fun in my 20s. I was staying at home living with my parents in order to pay off my student loans. But that was great to just kind of get going on my feet right as soon as I graduated NP school.
And you started off in ICU and now you're aesthetics. That's such a crazy transition. Like, how did that shift impact your view on healthcare and beauty? Because ICU, you're seeing a lot of tough stuff, especially, during, the rise of COVID.
So I was working through COVID as a nurse practitioner in the hospitals, and that's kind of really what started to burn me out a little bit, as much as I loved it. But that was a good experience to start off with, because when you work in a hospital, you kind of really have to learn how to prioritize and just get things done. And at the same time, you never really know who you're treating. Everyone looks, they're a patient in a hospital bed, and it's the worst day of their life. And so you really just learn how to care for people and treat everyone with respect and the same amount of treatment and dignity. So carrying that
definitely
aesthetics, it's really helped me to just, not judge people and just hear, what they're here for and what they're asking you for, and then take it from there. And so it was kind of a great way to start out and kind of set you up for success during the pivot.
Definitely. And what do you love the most about working in aesthetics compared to the crazy hospital setting? I mean, there's probably a lot of pros, but
there's
what are
so
yours?
Many perks to working in aesthetics.
I know.
Every day is fun. I mean, people are coming to you and they're like excited to be there. They're like, oh, this is my me time and I want to make myself feel better. And you as the provider is helping them to do that. In the hospital, no one wants to be there. They might be dying or having the worst day of their life. So it's a much different, level of, treatment type.
Yeah. And you leave, you go into work and leave work with a whole different mindset. In the hospital, you're so stressed, you're worried about your patients. Everyone else's emotions are weighing on you and you're doing the best you can. It's such a burden, especially after your time, 10 years. It's a burden that, you can finally relax and go into work and not have to worry about, what's going on with patient A, B, C.
Yes, you're definitely not dealing with people having a really bad time. So it's great. I love it. Absolutely love it. It's definitely not as stressful. The hours are easier on your body. You're not standing for 12 hours straight and working night shift and hospital shift and holidays. So
Yep.
Very different.
You served your time, girl. You deserve it.
Yes. I have so much respect for hospital nurses, and I feel a lot of RNs do transition from bedside into aesthetics. I found that that's very common too.
Definitely. And was there a specific moment or experience that made you realize like aesthetics was your new path? You were like, you know what? This is not for me. I got to go to aesthetics. I got to do something else.
Yeah, I mean, not one specific moment per se, but how I started was working per diem in aesthetics on the weekend. And I just realized how I really liked it. It was fun. I started to treat my friends and family. And then you realize that the money makes a difference too. You can make more money in a day doing aesthetics than working a hospital shift. So I just kind of like slowly transitioned out of it. And it kind of just happened naturally over time. And then when I was ready to quit my hospital job, it was a leap of faith, but it all worked out.
In regards to training or certification, did you go on your own and get training or certification, or did you get with a private practice or a med spa and they trained you on site there?
Yeah, so this is actually a really common question. I get a lot of messages actually from aspiring nurse injectors online. And there is no training in nursing school how to be a cosmetic injector. You focus on general medicine.
Nope.
In fact, a lot of the learning is on the job. Even they don't teach you in nursing school how to put IVs in. You kind of just learn when you get your first job.
Mm-hmm.
So a lot of it is self-motivated. And you do have to kind of put the research in on your own to find courses that you can take, working with people that you may know, asking around. A lot of it is self-motivated. So I was fortunate enough with hard work too. I kind of reached around and asked Dr. Truesdale, I caught him at the right time when he was just opening his practice, if he was looking for help from an injector.
Mm-hmm.
It's somewhat cold calling and knocking on doors, but I did offer to work for free if he was willing to train me. And I think that did show the hard work that I was willing to put in.
Your motivation and your drive.
Yeah. So I kind of just started there and I was shadowing him. He taught me so much, and then taking courses with the companies too, like Allergan and Restaurant and the different reps will send you to trainings because they want you to use their product. They want you to be familiar and comfortable with it. It's just learning step by step.
And learning straight off the surgeon's hands. Like, that is phenomenal. That's really great. You weren't learning off another nurse or YouTube. Like, you got firsthand practice from your surgeon, which is great. And Dr. Truesdale is an amazing surgeon. So it's only right that you're an amazing nurse practitioner and aesthetic injector.
Thank you. And that is a huge gap, in like how to get started. And so me and Dr. Truesdale actually created an online course teaching people how to get started becoming an injector. Going through it not so long ago, I knew what the key things for people were that they're looking for, and the pearls, the main tips that they need to get started. And so that was an awesome project as well.
And I also think, it's kind of unfortunate, but a lot of people who are becoming nurses really want to skip the hospital. They want to skip the skilled nursing facility. They want to skip the clinics and jump right into aesthetics. But it's not as easy. We see all these great social media nurses and nurse injectors, and they're living this life, and it's not easy. You still have to put in the work and the time. Just because it looks fun giving people lip filler, it doesn't mean it's any easier than, going somewhere else.
Yeah, it's super fun. And so at first you might have to start out doing something that, is not your main goal. For instance, you might start out at a clinic that offers IV drips and like a variety of other things to get started with. And then once you start building up a clientele and getting comfortable more with the nuances of facial anatomy and stuff like that, then you can start doing fillers. It's not something that people usually
you just jump right into.
However, I do firmly believe it is so much on a person-to-person basis. If you find someone who just gets it and they're smart and they're a quick learner, they might progress faster than someone else who has tons of experience, already. It's a total individualized thing.
Yeah. And based on, I'm the same way as you. When I was in nursing school, I was like, no clue about plastic surgery, no clue about general surgery, nothing. And I started working at an aftercare in Beverly Hills for a year. And that's where me and Jasmine met. And I said, you know what? I want to do Yeah, I said, I want to do surgery. And I had no experience. And one of the surgeons came by one day to check on their patients. And I kind of bombarded him in the hallway and was like, can I come work for you? I have no experience, but I'm willing to learn. I'm a quick learner and I'm motivated. And he kind of looked at me like I was crazy. And he was like, you have your nursing license? Do you have your CPR? Do you have all this? I said, yes, yes, yes. He goes, well, you can come shadow for a week and we'll see. And I was like, over the moon. I was so nervous, but I was like, I bit the bullet. Yes. And my first day in surgery, I remember it like it was yesterday. I was like, what the hell did I get myself into? What am I doing here? And the rest is history. But yeah, sometimes you just have to take a leap of faith.
Ask. Yes, shoot your shot. It doesn't.
And have to ask.
Say is no. Yeah, I love that.
Yeah, they might think you're crazy at first, but if you're motivated, things will turn out good.
Yeah.
Now, let's talk about our non-surgical aesthetics and anti-aging, which you are a pro at. You're known for taking a root cause approach to aging. Can you explain what that means and how it's different for more surface level treatments?
Yeah, so a lot of times patients will come in because they see some sort of issue that they're having on their face and they just want to fix that right away. But it's happening for some sort of reason at the primary cause.
Mm-hmm.
Just a random example is the nasolabial folds, for instance. People just want to put filler in here and get up and go.
Move on.
But there's other things happening as far as facial aging in the mid-face and above, or the skin is losing elasticity, the bone is changing, the muscle is falling, the ligaments aren't as tight as they used to be. So it's really just having that conversation on what the best way to tackle that issue is based on how they're aging. And so for some patients, you have to put them on some sort of a treatment plan or be realistic with the outcome that they get if they choose one thing over the other.
The filler hype and the Botox hype right now, people just want a quick fix and they're not really understanding the root cause. And, the biggest mistake are when people are trying to use all these injectables for anti-aging and you're like, hold on. Like, no, we got to get to the base problem of this because you're just going to have these reoccurring problems.
Yeah, absolutely. So I'm very much pro natural looking and doing things that over time it's going to help them to age gracefully, not just dumping a bunch of filler in at one time because that puts it at higher risk for migration. It can make the skin texture look weird and kind of spongy if you're doing too much. So kind of a stepwise approach and also a multi-treatment approach because just one thing is not likely going to fix the problem.
Fix all your problems. Yeah. And I love your approach on social media because you are educating people and all the girls on this topic. There's a lot of injectors out there just talking about let's fix your crow's lines, let's fix this, let's add liquid here, like all these things, but they're not talking about the anti-aging. And I think that's why your social media is, taking social media by storm because you're really deep diving into, okay, let's fix the root problem.
Thank you. Yeah, it's definitely something that I firmly believe in. And I'm always learning new things and adjusting based on the patients that I'm seeing. So aesthetics is an ever evolving field, but definitely I always have the best interests of the patient in mind.
Let's say a new patient comes in and they have like multiple signs of aging. How do you evaluate like what to treat first? Do you kind of ask them what they're most insecure about or want to fix? How do you go about that process?
Yeah, so I definitely start out by listening to why the patient is here in my chair, what brings them in, what bothers them, what have they tried before. And then based on what they're telling me, I'll give them an array of options of how they might be able to tackle this. And it really is also based on their budget and the downtime they have.
Mm-hmm.
Do they want to stick with only non-surgical or are they open to eventually doing surgery? Because that does change the treatment plan. And there's not a cookie cutter answer for what will fix their problem.
Yeah.
For instance, if someone has skin quality issues, we have a whole toolkit of things that we can use on them. Microneedling.
Oh, I love that.
Lasers,
options.
Skincare. So kind of just giving them the options about how much bang they might get for their buck, for one versus the other. So budget and downtime have a big part in that too.
I love that. I feel because a lot of people see on social media, because we learn everything off social media right now. Like no one's reading books anymore. No one's researching research articles. People are like, oh, I have volume loss and this worked for this girl who's probably a non-smoker, doesn't drink, 10 years younger. And the lady going in thinks that's going to work for her. It's like, I bet you have to give some girls like reality checks. Like, no. Like, for volume loss, these are your options that are best for you.
Yeah. Dr. TikTok is not the most friendly sometimes, but sometimes it's true. Sometimes their patients are very, very sharp with, pinpointing this is the type of look that I want. And they have a very realistic, achievable kind of goal. And so that's helpful also in some ways that they show me a picture of what they want to look like and it's realistic. And so that gives me a better idea of what they want. So it's good. There's good and bad.
Love that. And if a girl comes in for like poor skin laxity, like what are your top 3 tools that you would say, okay, maybe these are the 3 things that can help tighten that skin, look a little bit more snatched?
So when I'm assessing the patient, the first thing that I really have to decide is how severe their skin laxity is, whether or not they just need surgery or not. So if it's something that's not that severe, let's say you're in your 40s, noticing some early signs of laxity, that's a good time that you might be able to tackle this without surgery. And so there's different thermal energy delivery devices, and those are typically the best to address skin laxity. And so that might be something like using radio frequency, like Morpheus 8, ultrasound, like Shockwave, or lasers, like a CO2 laser or ultra clear laser. Those vary also based on the downtime and price as well.
Definitely. And that's why it's so good. So you guys need to go in, get your consultations by an actual doctor, nurse practitioner, not just following what you think you see online, because there's so many different tools that they can use on you depending on what's going on.
I love that. And that's really, really important because patients really, the most important thing is to make an informed decision. And you really can't get that without a proper consultation. And so sometimes if you just call to book an appointment and then you come in, well, maybe we could use something better with that budget that might work better for you than what you've read online. So consultations and informed decisions are the best way for patients to make decisions for themselves.
Definitely. Now, all over social media and TikToks, Botox and fillers, neurotoxins and fillers, it is taking social media by storm. And there are so many neurotoxins out there on the market right now. How do you determine which one is best for each client?
So I actually don't have a personal preference of one that's significantly better than the others. It's a very individualized thing. If patients have tried different neurotoxin, which one may sit the best or last the longest on them. So for instance, Dysport might last longer on someone else than Botox and vice versa for someone else. At the end of the day,
I'm a Dysport girl.
Love it. At the end of the day, they should all pretty much give you the same cosmetic effect. It's just person to person, they metabolize the toxin differently because there's different stabilizing molecules like proteins or peptides that are injected along with the neurotoxin. So not one better than the other, in my opinion.
Yeah. And I tried Dysport for the first time last year, and because I work out a lot, I do hot yoga, so I sweat a lot. And I noticed that it just lasts longer for me. And after the first Dysport, I was like, wow, like I don't have to go back. I was going 3 months on the dot. I can maybe wait till 5 now. And I love it. It works great for me.
Yeah, so a lot of times patients will say that to me, that they have a personal preference one versus the other, but there's no, uniformly unanimous type of toxin that lasts longer for most people. Now, something that is pretty consistent is the dose is duration. So if you do very small doses, it's not going to last you as long. It's like filling up your gas tank halfway versus the full dose. It'll still work. It's just not going to take you as far. So that is something that's rather consistent, as well as the reconstitution of the drug. We can mix it differently with saline. And so sometimes we want to hyper dilute the toxin. Let's say we want it to spread more, or if a patient's really sensitive, you want to poke them less times, we might dilute it more so it spreads around. Versus if we want to hyper concentrate something that's very, very concentrated for precision's sake, that would last longer than something that's hyper diluted.
And all the nurse injectors on social media, do you think it's like a myth when they're like, this is better than this one and this? Like, do you see that a lot? And what do you think about that?
Yeah, I think it's a myth because the studies don't back it up. A lot of times the studies done on the toxins are funded by the company who manufactures it. So I do believe that there might be a bit of bias versus what we see in the real world. So, for example, some of these studies say the average toxin lasts 3 to 4 months. In reality, we're seeing maybe 2.5 months. And that does vary, again, based on the dose. And as you said, you work out a lot, you're sweating, you have a fast metabolism. Everyone breaks it down differently. So, in general, yes, I don't necessarily believe if one person is claiming that one toxin always works longer than others.
Now, everyone knows about Botox in the forehead and the crow's feet and the 11s. Is there anywhere else that you're giving Botox that a lot of people might not think about or we might not know?
That's a great question. Yes, all the time. So other areas besides the standard trio of the upper face, we can inject Botox to help with migraines. We can inject Botox for a nasal tip lift, for a lip lift, for a gummy smile, for chin dimpling, for in the DAO muscle, for a little bit of downturn of the oral commissure. We can inject it in the platysma. We can do it for a Nefertiti lift, for necklace lines.
Oh my gosh.
Trapezius muscle for that kind of Barbie tox or elongated neck appearance, for the masseter, for teeth grinding or TMJ.
Everything. And you can even do it to control your sweating. I know people will get their Botox injected under the armpit, in their hands.
Yes, those are the hands and the feet are very spicy injections, but it's very, very effective for hyperhidrosis. I've had patients report between an 80 to 100% improvement. And it can last quite a bit of time to up to 6 months in those areas.
Yeah, that's so awesome. And going into filler now, you've worked with all kinds of filler, lips, under eye, even liquid rhinoplasty. What are the risks people don't talk about enough about any type of fillers?
I think the risks are pretty much out there too. Like TikTok and Instagram has, definitely the filler face thing is out there all the time. And so I'm noticing that a lot of patients are fearful of getting fillers now. Again, a lot of the times it's just overusing the product and not being judicious about how much we put in, especially at one time. So nuances like the tear trough, the under eye filler that you mentioned, this really needs to be injected carefully because that is a high risk for migration in that area, especially if it's injected superficially, and that can show up even months later. It can settle a bit unnaturally. Liquid rhinoplasty, the highest risk, there's not much room between the skin and the bone underneath. So compromising the blood flow to the skin tissue, lips, certain things. There's a risk for migration, especially with a certain technique called the Russian lip technique, where some of the filler is injected too close to the wet-dry border. And so over time, you can develop little beads at the bottom.
Oh my
It's
gosh.
a little bit lumpy. So there's risks with everything. It's more just doing it in a tasteful and conservative way without overdoing it.
And I feel like a couple years ago, not even maybe 2-3 years ago, people were pillow face. They were having these injectors overfill their face, overfill the under eye, overfill the folds, thinking filler is like this magical solution. And then they came out looking crazy, and then filler started to migrate. And I think that's when people started catching on. Like, why does she look like this? Why does Kylie Jenner look so swollen and puffy? Over injecting, that was like such a trend a couple years ago, and such a big shift now, such a difference.
Yeah, overdoing it. And I think fillers is a great way to kind of test out how revolumization of the face would look. However, long term, not to take away my own business, but long term, substituting it with a fat transfer, using your own fat is a natural, lasting way. But fillers are a great thing to test out. Like, hey, I want to fill in my temples a bit and see how that looks. And then, a couple years later, when it wears off, doing the permanent, natural, quote unquote, option is taking your own fat and putting it in.
And I wanted to get under eye filler, and I've had, friends in plastic surgery. They're like, no, don't do it. Try under eye PRF first. Try this, try that. Don't do filler. And I was like, all right. I'll try other things first. And I'm kind of glad I didn't jump and get the under eye filler when I wanted to, because I was this close.
I don't want to steer people away from filler, because I love filler when it has its appropriate place, and I do it all the time. And so I think I've had tear trough filler before. Dr. Truesdale did it on me, and it looked awesome. So not to stray people away from it, but there are other options out there too. As you said, you've tried PRP.
Yes, I love that. Now, diving into skincare and all these devices that are on the market right now, you've done a wide range of treatments, from lasers, RF microneedling, Skin Vive, chemical peels, and more. Which are like your top 3? I know it's like hard to say, but like, what are the top 3 that you're utilizing a lot right now, or people are coming in for that you love?
Skin treatments wise, I think you get generally the best bang for your buck. If I had to pick 3, number 1, microneedling. It typically doesn't break the bank. You see results within 7 to 10 days. Your skin looks more glowy and fresh. Love that one. Number 2, resurfacing lasers. So I love cool peel laser, CO2 laser, ultra clear. Those are great, and we can treat a very wide variety of skin issues with those. Number 3, chemical peels. I love a good peel.
Love
skin
that.
Just sheds off, and you're just like, I'm getting rid of all the dead skin, all the dullness. So I'd say those are my top 3.
Definitely. So your makeup can sit nicer, especially during the summer. Everything's not caking in and all this stuff. I love that. And in regards to microneedling, would you say like Morpheus 8 is a good one for your skin for resurfacing?
Morpheus 8 is great. I love both Morpheus 8 and regular skin pen microneedling. My Morpheus is a little bit more expensive because it has that radio frequency. So it does do a little bit more as far as giving a tightening effect to the skin. However, if you're younger, let's say you're in your 20s or 30s, and you don't really need that tightening quite yet, and maybe you don't have the budget to do the Morpheus, I love a good skin pen.
Yeah. So I would say, if people are girls, or they're clean girl aesthetic and they're in their early 20s, they're in school or they just got a job and they don't have that many funds, you think get a good chemical peel or get a good microneedling, and that can, help.
Yes.
So in the long run, you don't have to break the bank,
Yes, those don't break the bank. And when you're 20, you don't need anything super strong generally yet. So it all depends from person to person, but they're both great tools that I use all the time.
I love that. And in regards to skincare, even getting more basic than chemical peels and microneedling, is there anything you recommend to the girls that are just starting off? Any skincare that they could buy at Ulta or Sephora just to start working on their skin if they can't even do microneedling?
Yeah. So there's not a cookie cutter answer to that, but in general, I'd say if you're just starting out, at the very minimum, wear a sunscreen every day and use some sort of retinol-based product. If you can't use that every night, do every other night, a couple times a week. But that would be a good way to start as far as preventing, the aging process and the breakdown of how your skin appearance is. At the very minimum.
The very minimum sunscreen, which I am ashamed I do not wear
Really?
sunscreen. I know. I need to.
I love a good tinted sunscreen.
So
Kind of acts Go ahead. Go ahead.
I just bought last week because people, I'm not going to name names, are getting on me. I got the Elastin skin tint sunscreen situation. Finally, I was like,
Yes.
fine, I'll wear sunscreen. I've been
Yes.
so anti-sunscreen. I don't know why. It's like an extra step. And I'm like, I'm inside all day working. Like, do I really need it? And then I found out the lights in the OR and everything can also cause anti-aging.
Everything.
I was like,
Yes.
what?
All of the light reflects and it can age your skin over time. And there's different types of sunscreens too. There's sunblocks and sunscreen. I love the tinted one, not only because it takes place of your foundation. If you have good skin, you don't need to take on anything heavy.
And that was another option.
The minerals versus sunscreens, you're actually absorbing that heat into your skin and dispersing it. So there's a little bit more aging and burning that can happen with sunscreens versus sunblocks. So the tint has the nice minerals that block.
Love that. I did not even know that. I just got it and was like, all right, I will do it since everyone's on my butt. But for all the girls that work inside, you still need sunscreen. You heard it first here from Nurse Jess.
Yes, very important. Very important.
And you also specialize in treating skin of color, which is so important. What should patients know when choosing a provider for treatments like lasers or RF microneedling if they have darker pigmentation?
Yeah, so skin of color definitely requires a different type of skill set and knowledge based on how these energy delivery devices are going to rejuvenate the skin. So I feel for the clients in this way, as far as you don't know all of the things that we know, and you have to choose someone who you trust, and how are you going to do that? And so that honestly is difficult to do. So I would say doing your research on who you're going there and feeling like you trust them. Do they have experience with treating skin of color? Maybe asking, how is treating skin of color with this device different than a Caucasian person? How is the treatment different? A lot of times skin of color might need a more low and slow approach, not to damage their melanin or the melanocytes. Or using a little bit less heat each time. So it's really important as far as not to have any adverse effects.
And even isn't it true with like laser? When you go get hair removal for laser, it has to be at a lower frequency because of the darker skin pigmentation as well?
Yeah, it's different. So, for instance, some light, for instance, IPL. Let's just imagine, I like to explain it this way. If you're out on the beach and you have a white beach towel and a black beach towel, the black beach towel will be hotter because it absorbs more light.
Yes.
It's the same thing when we're putting these lights or lasers over the skin. It can actually gently target the melanin too much.
Oh my gosh. That's a great explanation.
Yeah. So that's kind of an easy way to conceptualize how certain energies are not safe for darker skin tones.
Yeah.
But there definitely are lasers out there that are safe for darker skin tones. And of course, in the right hands. A lot of these devices are very operator dependent. So there can be adverse events with any type of device, no matter how, quote unquote, safe it is, who's operating the machine.
Yep.
So that's really important.
And what are common mistakes you're seeing with people, like have people come in and I tried going here and they have darker skin pigmentation and they mess them up? Or have you seen online, like have you seen any common mistakes in that area?
I think the mistake sometimes by providers is being overconfident and not really realizing, the potential risks when they're treating someone. Patients certainly have gone to other providers for things like IPL or CO2 laser. Like, yeah, it can be done, but I think it's the unknown. So the provider really has to have experience and know how to use the device on skin of color. So again, as the patient, I do feel for them as far as choosing that person, because your provider can tell you something, but is it true? You really just have to believe them. So researching who it is and if they have experience with skin of color.
Definitely. And like we said, even if you're not getting plastic surgery, you're not laying down on the operating table, it's still also important to do your research as you would on a surgeon for a nurse injector. Anything going into your body or any skin treatments, it's very important to do your research and ask questions. I know a lot of patients go in and they're afraid to ask questions because they expect the nurse practitioner or the doctor to know everything. But you know, as patients, you do have the right to ask these questions. Hey, I have darker pigmentation. I don't want to look jacked up. Have you done a lot of patients or do you have expertise in this? Like, you could be nice about it and ask questions, but I mean, you have to advocate for yourself.
I love when patients ask questions and I can tell who's done their research, and really deciding what they're going to do with their face. It brings me joy to have those conversations. And then it's really more of a collaborative thing too, because they've done their research. They kind of know what they want and don't want. And then we can decide on the best path forward. So asking questions, never be afraid to ask a question to your provider.
Definitely. Don't just go off the 1 or 2 TikTok videos that you saw at midnight and decided you're going to go in and get X, Y, and Z without really doing your research. And if it's great for your skin pigmentation or your age or anything, like, it's so important. Now, another big trend that we're seeing all over, which is driving people literally crazy, and there's so much talk about it, good and bad, weight loss medications.
I was wondering what's going. Yes, weight loss.
Yes, girl, you help manage patients on weight loss medications. What are the biggest misconceptions people have about these meds? Like Jardiance, Mounjaro, Ozempic, all the big names, and there's tons more that are coming onto the market, but what are the biggest misconceptions?
A couple misconceptions I would say is that people think that they might have to stay on it long term, that once they start, they might never be able to come off of it.
Mhm.
And also that it's kind of like a miracle drug and they might not have to do of their own work as far as
Yep.
adjusting lifestyle. Those are really the biggest misconceptions, I guess.
Definitely. And, people think, okay, I want to get plastic surgery, but I want to, get down to my goal weight first. And I'm just going to do Ozempic for 6 months or 8 months, whatever it is, but are still heading to Chick-fil-A and are still going to
Yeah,
Taco Bell and they're not getting their steps in and they're not drinking their water. And then they're like, this is trash. Like, going on social media and just talking nonsense, but you're not making these lifestyle adjustments. You're not doing anything
yeah.
to help Ozempic help you.
I'm pretty clear with that with every person that I see and at every follow-up asking them, what bad habits might they have to have caused them to gain weight, or if they're struggling to lose the weight as fast as they would have liked, the lifestyle habits behind it. And so these drugs really do help you get going with changing those things.
Mm-hmm.
For example, 70% of the American diet is focused on carbs, and we get addicted to carbs,
Yep.
and overeating as well, and eating takeout food. So I ask each person, what their dietary habits are. And when you're on these drugs, the food noise kind of dissipates. You're not thinking about food as much.
Yep.
You're not fighting off the cravings. So it's much easier. Like, hey, if I'm not that hungry, but I know it's mealtime, let me eat something healthier. A lot of patients too say that the reason that they're eating bad is because they're so busy and they can only get convenience food. There are healthy
Excuses.
convenience. There are options as well. So it's really just reinforcing that with every visit, how important it is, because they might lose the weight on these drugs if they're still eating Taco Bell all the time and they're just eating less. But then once they stop the drug,
Yep.
they're going to rebound that weight gain, sometimes even worse. So
Yeah.
really,
So
really important.
even if you're taking Ozempic as the easy way out, okay, you take it, you lose 60, 80 pounds, whatever, and you get off it, guess what? You're going to gain that 60, 80 pounds right back. You still have to do the work. There's no easy way out. You have to change your habits. There's just no way around it. Sooner or later, it's going to catch up to you.
Yes, the same with exercise as well. So I tell patients that the drugs, hopefully mostly fat will come off. But if you're sedentary, it's not necessarily with or without the drug. Let's say you reduce your calories to 1,000 calories a day and you're sedentary, some of your muscle and even your bone can
Yeah.
start to waste away. And
Your
so
muscle mass, your bone
I haven't had
density.
this myself, but I've heard even 30-year-olds on Ozempic lose a ton of weight, they don't do anything, and then they develop osteoporosis. So it's really important to exercise to continue that bony remodeling and to stimulate muscle growth to prevent side effects.
Yeah, and muscle mass, it goes away so quick, especially as we age. We need muscle as we get older. It's so important and so vital. And if we could start working on it as we're younger, it's key to longevity and health and having, a greater life as we get older.
Yeah, very important. So that's one of the key things that I think is different with the actually created pretty much the weight loss program that we have at my office versus some online places where you can just fill out a questionnaire and then they ship it to you. There's really not guidance and on how to adjust your lifestyle, and patients like to come to the office because they know I hold them accountable.
Now, let's say that someone wanted to lose 50 pounds and they lost their 50 pounds. How do you wean them off safely? When you start tapering down the doses, and how long does that typically take?
Yeah, so I definitely recommend a wean down in most cases, unless a patient has been on it for a very short time at very low doses. So depending the duration of time that they've been on the drug and how high of a dose we've gotten them to, I do recommend a wean down process. And so every week or every other week, we can reduce the dose and then get you to a point where you're on a very low dose, taking it every other week. And at that point, you've gotten yourself into hopefully a new swing of a routine where you're keeping the weight off. You're not relying on the drug as much anymore, and patients feel comfortable that they can stop.
And what about this poor trend that, I'm going to take Ozempic for 3 weeks before my vacation and then not take it. And then I'm going to hop back on it for 2 months before this vacation or Coachella and then hop off it. What is the risk? I don't even know too much about it, but I see that girls are doing this and I'm like, I don't think you're supposed to be doing it that way.
Yeah, starting and stopping is very confusing to the body. It can your metabolism gets all confused, your hormones and what's going on. So I definitely don't recommend starting and stopping like that. So especially if you don't truly need it for being obese, or any comorbidities like high blood pressure, high cholesterol, if you have sleep apnea, things like that. In general, if you're just doing it for weight loss, not to start and stop.
Yeah, I hate seeing that. It's like, I'm going to take Ozempic for 2 weeks because Coachella's coming up. And then it's like they're buying it high end from the celebrity doctor. And I'm just like, what are you doing? That is not for that.
I have criteria too on who I will give it to. Because sometimes if patients do weight loss like that and they don't really need it, there's some sort of underlying, I don't want to say it's a full-on eating disorder, but it's almost facilitating that hyperfixation on their body weight. And it's not healthy for patients to be so obsessed with their body weight like that who don't really need it.
Definitely. And how long are you helping your patients maintain the results once they're off the medication, the weight loss medication?
So that varies. So I'm with the patients through their wean down process, and I'm asking them how they're doing with tapering down the drug, if they still feel like they're in control, if they're maintaining their diet and exercise. Once they stop the drug, typically patients have formed enough of a connection with me that they're coming back for some sort of aesthetic treatment. So I'm seeing them here and there anyway.
Love that.
For Botox or for a chemical peel. So that's most of the time where I check in on with them, how they've been doing since they've stopped the weight loss program. And so a lot of patients have been so happy and been able to keep the weight off. Not everyone, of course, if they don't adhere to true lifestyle changes, but I'm always checking in with my patients on how they're doing. I really care and I love my patients. They're amazing.
Good. You are a follow-up queen. You don't just treat and disappear.
Yes, definitely don't disappear.
Love that. This has been so educational and I've learned a lot. But for anyone nervous about starting off their aesthetic journey, what would you say to them?
I would say just do it. If something has been bothering you so much that you're thinking about it day in and day out, it really is such a confidence booster to just get rid of that insecurity if you address it and do it for yourself. A lot of other positive things come with that. When those insecurities just go away and then you live your life without being hyperfixated on if you have something wrong with your skin or even plastic surgery, just go for it and do it for you, not for anyone else.
Yes. And what is a typical life if someone's like, what does a nurse NP do in a private practice doing injectables? What is kind of a day in your life if you can, I know it varies from day to day and patient to patient, but typically, how does your day look like at work?
The day is usually pretty full, and so it varies on whatever's on the schedule that day, but my whole list of Botox fillers, lasers, microneedling. I usually have some sort of lunch with a rep who wants to come in and talk about a new device, which I do love because I'm always learning about what's out there on the market and comparing it to what we have in the office. I love to maintain a good lifestyle balance, so I typically go to the gym.
Love that.
5 days a week. I cook at home. Like to just wind down in the evenings. It's busy, but it's a well-balanced life, and I'm very happy with being a nurse practitioner in aesthetics.
And being the only nurse practitioner at a private practice, especially like Dr. Truesdale, you are busy. You guys are powerhouses right now. You are on everyone's radar. Do you have an assistant? Do you have a medical assistant, like anyone to kind of help you throughout your day? Or are you kind of taking everything on by storm and doing it all?
Yeah, we have medical assistants that definitely help a lot with the office flow, taking pictures of the patient and, helping to answer some of their preliminary questions. We always are growing. And so we do have new staff as the practice is growing, and it's grown so fast. So definitely busy, but all in a good way.
I know. I got to come check out your guys' new surgery center right across from.
Yes, please.
Yes,
please
right across from Dr. Zarabi. So I haven't seen it yet. But I passed by it on a Saturday. I was helping Dr. Zarabi out a couple months ago in December, and I saw your guys' little plaque. I was like, oh my gosh, they moved right across, the door across the hallway.
To have you over.
Definitely. And where do you think the future of non-surgical aesthetics is headed, especially with all this new technology coming out on the market?
The future, I think, generally is headed as far as better results, less pain, less downtime.
Definitely.
It's constantly evolving. I remember the first time I got laser hair removal years ago, I almost cried. It hurt so bad. So it's always improving.
Definitely.
Now it's much easier, much more effective. I think constantly just evolving in that direction, making the experience for the client easier and less painful with better results.
Love that. And your skin is so clear. It's so great. I love it. What are you using for skincare? You better send us some details.
I do all the things that I do in my office pretty much. I try to keep the best things going in the practice. So chemical peels, microneedling, laser, good skincare products. I love Skin Better. I use a lot of their stuff.
I was going to say your skincare products, even at a basic level, are you doing face masks? Are you doing vitamin C? Are you doing hyaluronic acid? Like, what are you doing?
Yeah. I use a retinol at night. I use moisturizer during the day, sunscreen during the day. And then it's a little spotty here and there. I do use vitamin C's. I use the Ultra Defense Serum and Maestro. I have a lot of skincare products at home.
So you kind of mix and match
But
depending
I
on
am
your vibe for the
consistent
day.
depending on the vibe for the day. But I am consistent with sunscreen and the retinol.
I love that. And last but not least, what's your personal philosophy when it comes to beauty, aging, and staying confident? Because, as we all get older, we see signs of aging, and it's hard. Even if, we're not so concerned about it, we do see ourselves aging. And sometimes that takes a toll on our mental and our emotional.
Yeah.
And what do you kind of tell your patients and even yourself?
Yeah, definitely give yourself grace. We're all our own worst critics. And so we
Yes.
see these little things on our face that just drive us nuts that no one else in the world ever sees. So
Mm-hmm.
if there's something that really bothers you, go ahead and take care of it. But beauty definitely comes from within, and just being happy, having a good health is all to be grateful for. Just, giving
Definitely.
yourself grace and not being too hard on yourself.
Yes. And we just started 2025. What is up and coming for Nurse Jess? Anything personal, professional, any big announcements or anything to stay tuned for?
There's so much in the pipeline. I don't want to say too much, but things are always growing with the practice, and personally as well. I have some vacations coming up, which I'm really looking for.
Love that.
I love the new devices that we've had in our office, the ultra clear laser. We have some conferences coming up, so just getting out there more. And I do appreciate you having me on this podcast as well. This is part of some of my personal goals, seeing more visibility. So this all happened in great timing. I appreciate you having me as a guest.
No, we appreciate you so much, and your content is amazing. It's educational. You're here for the girls. You're just support everyone aging, and it's just honestly so beneficial. And we'll definitely tag Nurse Jess so you guys can go to her page, and if you have any questions for her, and take a look at all her great content, and even go to her office and get a consultation and not watch TikTok videos.
Feel free to send me a message on Instagram. I'm very active on there, so I answer a lot of questions. And of course, I'd love to see you in the office. And you too, come swinging by.
I know, I gotta come swing by. And really quick, do people ever hit you up about surgery as well, not just aesthetics? Like, hey, Nurse Jess, I think I want lipo of my abdomen. Do you kind of defer people to Dr. Truesdale, or do you kind of answer some questions for them as well?
Yeah, I definitely can answer some preliminary questions, or at least do a screening. In the office all the time, I kind of do mini surgical consults as far as telling patients if they're a good candidate for it, and then they move forward and see Dr. Truesdale for the formal consultation. But I'm absolutely happy to answer questions about surgery.
Well, you heard it here first, you guys. Go ask Nurse Jess all the questions from aesthetics to surgery, and they will definitely help you out. And it has been such a pleasure. You are so educated on your topic. You have great skill, and I'm so excited for you and Dr. Truesdale and what's more to come. And it's very exciting. And I thank you again. You are our first nurse injector on the podcast, which is
an honor.
Nurse Practitioner Injector, I will say.
Yes.
So
excited for you with this podcast too.
Yeah, and we started this brand last year, and it's so crazy when patients come in and they're just not informed. And there's a lot of surgeons out there that just sit behind a desk and they don't help with the pre-op, they don't help with the post-op, where to get your supplies, like all the things that the girls need help for, lymphatic massages. They're so hyper focused on the surgery itself and the process and the complications. But we're here to help. We're here to help people make the best decision for themselves, showing the pros of surgery, showing the cons, so that they can make the most educated decision for themselves if they want to do it. So that's what we're here for, and that's what we're trying to do.
I love it. Thanks for all you do too. I know your world is a little bit different than mine, but I'm sure you're filling in some of the unmet gaps in plastics.
Definitely. Well, Nurse Jess, you did work today and then you came on the podcast. So I want you to enjoy your Saturday. It has been a pleasure and I appreciate you so much. And you are gorgeous. And we thank you for everything and all your education you brought to All Things Plastics podcast.
Thank you. Thanks for having me.
Of course. All right, you guys, we will talk to you next week. Bye.